Hello and namaste from India. I am Dr. Karan Thakur and I work for the Apollo Hospitals Group based out of New Delhi. The Apollo Hospitals Group is India's largest healthcare enterprise. We operate 70 hospitals and a large pharmacy and clinics network. We serve a diverse set of communities, whether it's high income self paying groups, middle income insured groups, or below the poverty line government sponsored patients. Given our spread, we feel the impact of climate change through our patients, their families, and our staff. India is subject to a wide array of climate related impacts, and we feel those too, whether it's air pollution, heat waves, heavy rains and flooding, coastline events, or even vector borne diseases. Given this, our board mandated us to create an action plan towards sustainability, climate action, and decarbonization. This plan, the Apollo Sustainability Action Plan, was put together in late 2021. Our first task was to actually see and measure our footprint. And that's where the challenge emerged. For we had diverse set of data available to us on our emissions, waste and water, but this was disaggregated and we could not get a clear picture on where we stood in terms of our emissions framework. Therefore, the board empowered a committee to create a solution that we could actually implement enterprise wide to create a carbon footprint measure for us and get a good inventory so that we could create targets and work towards decarbonization. We considered multiple options, whether to actually build on our existing hospital information system, use static tools like Excel sheets or other such formats, or actually create a customized tool for this. We worked with a partner to start work on a customized software, and we looked at all the international repositories that were available, but most notably, we used the Healthcare Without Harm's climate footprint that helped us actually create this architecture for us to start measuring our emissions framework and also use the GRI framework to help us look at some of the standards that exist out there. We got our board to actually look at this software after creating it with our partner. They were very happy with this, and in May of 2022, they gave their go ahead. We launched pilots in June and July of 2022 in two of our hospitals, in New Delhi and in Ahmedabad. And we also created standard operating procedures for collection of data, reporting of this data, and other such metrics. Training will also follow during those 2 months for staff members of those two hospitals. Given the success of this, we were very happy to actually look at a full rollout. And from July to November of 2022, 40 of our hospitals covering 9,000 beds, which actually accounted for 90% of our emissions footprint, were covered through this new software. Training and SOPs for them for these other hospitals was also continued and finished with by December. Four pillars of this journey are very important and we like to highlight them. The first is the iterate to fit. Once we created the first visualized form of the data that we got, it actually helped us compare data sets, look at variability, intensity, and also see how we could actually look at our emissions from a different lens. But very importantly, this also created a self perpetuating cycle where other hospitals, once we showed this data to them, were actually joining the bandwagon, and existing hospitals saw the advantages of creating such a framework. Regular monitoring was a very important pillar. We created an implementation task force, had the board being reported upon, and also sought guidance from on what we should do and how we should tweak the process to ensure its smooth rollout. We got the hospital CEOs bought into this entire process, given the importance of decarbonization that was traveling from the board. We identified the skill and training needs and made sure that we could plug those gaps. And we had a green champion in all of our 40 hospitals to make sure that they would implement on the ground. Phasing is important. We could not do this in one go, given the large size and spread of our hospitals. We phased this into two parts. The first phase is now over, where 40 of the hospitals are reporting data for the past 2 financial years. In the next phase of this project, we are now going to be setting targets for those 40 hospitals and see how we can track them over the next couple of years. De-risking was the final and most important pillar. We got the team aligned towards a common goal using both adaptive and hierarchical approaches that were available to us. But most importantly, we fostered a shared purpose and common commitment towards this important goal for healthcare to contribute towards climate action. We expected technical glitches but were prepared for it and de risked that, and also worked critically on awareness building for our staff. The results have been very encouraging. This is some of the dashboards that are now available to us at the click of a button for every administrator, CEO, and a green champion, so we can actually act on these. And this has also helped us visualize where the pain points are or the easy picks are for us to act on in the coming year. There have been multiple reasons for the success of this project. A few of those include having a good governance structure and a monitoring framework, to build teams, to get buy in from critical people, which includes not just the CEOs, but staff that work on the ground to deliver care, and also to ensure that we are creating a sense of common purpose towards this important goal of decarbonization. But we have an ambitious plan going ahead. We want to cover 100% of our inventory envelope. So the remaining 10% will also be covered over the next 3 months. By June or the end of July maximum, after we get permissions, we will set targets for all our 40 hospitals now that we have such good data flowing in. We would want to include some parts of scope 3 emissions, which is a major pain point for healthcare, to be included by March 2024 and begin monitoring that in the next couple of years following the identification and marking of that. And we would also like to bring in other stakeholders to make sure that the emissions framework is robust. Currently, we are part of the Race to Zero framework for only our hospital at Apollo Hospitals in Delhi, but we'd like to include 5 more locations by the end of this year so that we can actually achieve halving of our carbon footprint by 2050. This has been an important project for us, and we would like to thank Healthcare Without Harm, without whose help and guidance we could not have actually put this program together. And we want to make this a guiding star, this program to be some sort of an example, not just for Apollo hospitals, but for the entire Indian healthcare system as we make that change and shift towards meaningful decarbonization in the weeks and months ahead. Thank you.